I'm Dr. Ruth Labode from the Lancet Global Health Commission, which was recently launched. I'm now a commissioner. This was very interesting for me because I met people I've worked with when I was a parliamentarian. I'm glad that the issues are being carried forward. We worked as a parliamentarian on issues of access for adolescents. We worked as a parliamentarians on amendment of the Termination of Pregnancy Act. We also repealed the willful transmission, which I picked in this room that it was misunderstood that it is being revived. It's not being revived. It was set out. Of course, remember the willful transmission was consent between adults. A child cannot be willful transmit anything because it's a child. So if you do that to a child, it's still a crime. But doesn't mean we have actually repealed the willful transmission. But in two consenting adults, nobody will be arrested for you infecting each other because you should have used condoms in the first place. So today for me it's like we were evaluating our work in SRH. And I think it was very good. And I'm feeling so good because there's a lot of progress on where we left on termination of pregnancies already in Parliament, and there's success here, Wilsa. That was wonderful. That was a big victory. Now I've urged parliamentarians to push the matter further from where Wilsa has done, because we don't want to hear that the Supreme Court has decided there was something wrong. We need to push it and push it further. I'm hearing also that the access work has gone to the Minister of Justice and is bringing a bill to Parliament. That is a huge success. Sex workers have had their dialogue where they are now lobbying for decriminalization. For me, decriminalization of sex work is a low-hanging fruit because the minister per se, the Minister of Justice, the Minister of Foreign Affairs just feel that it's just tints the country. It's a diplomatic disaster. In a country where sex workers, yes, they are stigmatized, there are issues of gender-based violence, but we can say comfortably they enjoy some freedom. So because of that, there was a time when the president was booed in America, and that created a problem. And I think, and our culture also, that sex workers are spiritually infected with some traditional spirits, which where the language of Shaberechi Ure and Ijozles Ure comes from. So my argument, of which I'm urging sex workers will use, is that if they are possessed, why are we criminalizing them? So we should decriminalize based on our religious and cultural arguments, and I think that is almost done also. So there's a lot of success of work. There's the issue of fistulas. Fistulas, as long as we are failing to control our child marriages, we will always be stuck with fistulas, because somehow we have passed a law, we have criminalized child marriages, but we have no way of enforcing it. It seems somehow it's a difficult one. So I'm hoping going forward, the organizations that are here, they were urged also to galvanize and work together. I also feel there's a lot of verticalization of programs, everybody doing the same thing and everybody wanting to go their own way, everybody wanting to be in front. Let no NGO be in front. Let every NGO celebrate the victory we have in SRH. Thank you.
My name is Mchanyara Cynthia Mukamuri. I'm the Executive Director for Self-Help Development Foundation and also the Chairperson of the Women's Coalition of Zimbabwe. Today here at Sabri, there was an Indaba for women and girls ending the child marriages and also the promotion of sexual reproductive health. This was a very fruitful day because there was discussion coming from all sectors, putting across the gains we have made towards the sexual reproductive health, and also the gains that we celebrate, especially after the Wilson's case that was won on termination of pregnancies. We are so glad to say, while we still have challenges and there's a lot of work still to be done, but we celebrate the gains, we celebrate what we have won, but we forge ahead with plans where we need to work together in a multi-sectoral approach, where all individuals and all programmers in sexual reproductive health and rights should continue to thicken their voices, should continue to campaign against rape. I wouldn't call child marriages, because it is simply rape, because age for consent for sex in Zimbabwe is 18. Therefore, we want stiffer penalties for the perpetrators of those, and we want also safe abortion for the girl child who was raped, because they are children. And for that reason, again, we also want improvement in the provision of services, provision of quality public health services, provision of quality sexual reproductive health services across Zimbabwe. We also wish for us not to shy away or to have a wishful thinking to just say problems will disappear. They will not disappear on their own. We need to put our hands on the deck and all of us playing our part, particularly now during the 16 days of activism, where it's not only about 16 days, but throughout the day, and this should start from the family level. Are parents able to communicate issues relating to sexual reproductive health with their children? Do the teachers in the classroom able also to teach or to talk about it? What is our stance as a community? Because we continue to see grade 7 students, female students, failing to write their exams because they are pregnant. It's a shame as a country. As such, we need to change our attitudes, our perceptions, and also act up to ensure that there is inclusion, to ensure that even in our health service provisions, nurses and service providers are also trained in sign languages, to also ensure that a person with disability does not remove the feelings, therefore the stigma associated with people with persons with disability when they seek health services is still a shame in a country, especially 2024 as we go. So we implore all organizations that are working on sexual reproductive health and rights to also change their strategy to ensure that there is inclusion, to ensure and advocate for the implementation of policies that we see not happening in Zimbabwe. So it was a fruitful day. We had takeaways back home where we need to rethink as we plan for 2025 on how best we can achieve the desirable status quo in our programming. So as women's rights organization under the Women's Coalition banner, we also commit to join other actors in ensuring that the community of Zimbabwe is having a quality sexual reproductive health and other health services through continuous advocating for these rights and also for the provisions of safe abortion as we go. Thank you.
My name is Lucia Masuka. I'm the Executive Director at Amnesty International Zimbabwe. Today we met at Sabre for a stakeholder dialogue, or an Indaba, on ending forced marriages, early forced marriages, and promoting universal access to sexual reproductive health services for adolescents. The objective really was to bring together stakeholders that are working on promoting access to promoting universal access to sexual and reproductive health services, to have a conversation on the barriers that are impacting access to sexual reproductive health services by adolescents. We have picked up from the media and from reports increased incidences of adolescent pregnancies, increased reportage on cases of child or forced marriages. We have also noted the challenge or challenges that women who have a condition called obstetric fistula, which is a maternal morbidity, have to contend with. So the objective really was to come up with strategies in terms of addressing the various barriers that we pick up, which are in the form of gaps in legislation and policy, as well as harmful cultural norms which impact young women and girls' ability to access sexual reproductive health services. There are different views that really came up, but there is consensus that there is a challenge as reflected in the statistics that have been recorded in this country. Just in 2023, 680 girls between the ages of 10 and 14 registered for prenatal care, and these girls were pregnant. These are girls that are aged between 10 and 14. During the same period, as a country, we recorded in excess of 51,000 pregnancies relating to adolescent girls. So this speaks of a challenge that we have. And in our view, this challenge can be addressed through various strategies such as policy and legal reform. And one of the areas that has been problematic is an area that relates to restrictions in terms of access by adolescents to sexual reproductive health services, where the law, Section 35 of the Public Health Act, provides that for people without legal capacity, and children would fall into that category, they do require the consent of their parents to access services. And this then extends to sexual reproductive health services. So for instance, if a child perhaps is engaged in sexual activity and they've got an STD, they would require support from a parent in order for them to access services. But as you know, this is problematic, because that young person may not be willing to disclose that this is the condition that they have, and as a result, they may suffer without any assistance or medical intervention. The same applies to accessing of contraceptives, accessing of condoms, which is also problematic for them, despite the fact that they require these services, because some of the teenage pregnancies that we have recorded, or most of them, are as a result of these young people failing to access sexual reproductive health services, as well as a lack of information or information on their sexual and reproductive health rights. So we're here to deliberate all those issues, and stakeholders did agree that there is need for us to collaborate on the various areas that we identified. There's need for us to collaborate as far as pushing for legal and policy reform is concerned, so that we really address the structural issues that impact young people's ability to access sexual reproductive health services. There was also consensus that there's need to look at the financing of the relevant ministry, the Ministry of Health, to enable it to provide the services that are required. There was consensus that there is need to push for a change or a shift in norms and beliefs and attitudes that impact the ability of adolescents and young women to access sexual reproductive health services. So these are some of the deliberations that we touched on as stakeholders. And as Amnesty International, this is an area of interest to us, particularly because if the area of access to sexual reproductive health services is addressed, it will also address one of the conditions that we picked up in one of our researches, which is titled, I never thought that I could heal from this, which is a condition called obstetric fistula, which develops, women develop whilst giving birth when there is obstructed labor. And what we have picked up from our work is that young people or young girls are at risk of developing obstetric fistula. So if we facilitate access to sexual reproductive health services, it means we reduce the incidences of adolescents or teenage pregnancies, and we also then reduce incidences of obstetric fistula. So yeah, these were the conversations that we had today.
My name is Shaka Rujidzo. I'm the National Coordinator for Men for Equality Trust, and we're an organization that works to support the issues of gender equality for all genders, men, women, girls and boys. And from this Women and Girls Indaba that was organized by the Women's Coalition of Zimbabwe together with Amnesty International Zimbabwe, we really learned a lot about the importance of putting issues of adolescents, sexual, reproductive health and rights issues forward. It's a fact that young people are engaging in sexual activities. So we need to actually come up with a comprehensive approach which is practical, that looks at ways that we can support these young people so that even our laws, they need to be in harmony, because we have got laws that are actually speaking one thing and then they are also like acting against each other. So we need to support the laws and advocate for the laws to be realigned and speak the same language. Now the other issue that I also had as a key takeaway is that we really need to work together. We are tired of the silos. No glory should come to one organization, but the glory should come to the beneficiaries that we intend to support, who are in this case the women and girls and the whole communities that they come from. So we also need to work around that. And lastly, it's very important to work with the cultural leaders. Our traditional leaders, they need to be given even the rights to even prosecute cases such as the early child marriages cases, because they also have that power within those communities where they come from. We also need to educate these gatekeepers within the communities so that they take action to say that not in my village, not in my community, we do not condone any form of sexual violence against girls and women. I thank you so much.